next two speakers who are about to have a conversation concerning health care. And I thought hard about how to introduce these two men. And the more I thought about it, the more I realized how much they have in common. They're both left-handed. They both love golf, a game that does not often reciprocate the love they put into it. They both are fanatic sports fans and go to great lengths to be in front of the TV or on the side of the court or the field. They both are master politicians. Each of them has only lost one election. They are both Democrats. They have fabulous daughters. They each married far above themselves. And they each love our country. And so please join me in welcoming number 42 and number 44, Bill Clinton and President Barack Obama.
Mr. President.
Are you interviewing me? I was going to thank you for doing a hell of a job. That was a good thing you did. Well, thank you for coming.
Well, it is wonderful to be back, and let me start just by saying to all the people who have, for years now, supported the incredible efforts of CGI, thank you. Because wherever we travel, all across the globe, we see the impact that it's making every single day. And we're very proud of what you all do. And let me say that we still miss our former Secretary of State. And I should add that there's nothing she said that was not true. Particularly the part about us marrying up.
Well, that brings me to my first healthcare comment. This is going to be a conversation about, maybe at the end of this conversation we can get back to some of your current global health initiatives, but let's talk a little about the healthcare law. Because we're about to begin on October the 1st, open enrollment for 6 months. And I'd like to give you a chance, first of all, to tell them why, when you took office, we were teetering on the brink of a depression. You had to avert it. You had to start the recovery again. Why, in the midst of all this grief, did you also take on this complex issue? Many people were saying, why don't he just focus on the economy and leave this alone? So tell us why you did it.
Well, first of all, I think it's important to remember that healthcare is the economy, a massive part of our economy. And so the idea that somehow we can separate out the two is a fallacy. Second of all, the effort for us to deal with a multifaceted healthcare crisis has been going on for decades. And the person who just introduced us, as well as you, early in your presidency, had as much to do with helping to shape the conversation as anybody. The fact is that we have been, up until recently, the only advanced industrialized nation on earth that permits large numbers of its people to languish without health insurance.
First of all, folks, for those of you who are from the United States, that's about as good an overview as you're ever going to hear of what this economic issue is. But you remember the president said our structural deficit would disappear if we had a comparable healthcare system in terms of cost to the French and Germans that are consistently rated the highest. It's about $1 trillion a year, and there's somewhere around 44% of that money is government-funded money. So you just run the numbers. Think over half of our deficit's already disappeared because of economic growth and the revenues you raise and the spending we cut. And you pretty much get rid of the rest of it if we just had a comparably expensive system to any other country. Before you took office, we lost a car company that wanted to locate in Michigan that went instead to Canada, and they announced, they said, look, we're a car company that provides health care benefits to our employees. We're not a healthcare company that sells cars to cover our bills.
When we passed the Affordable Care Act, there were a number of components to it. A big part of it was essentially providing a patient's bill of rights that Americans and advocates have been fighting for decades. So what we wanted to do was make sure if you already have health insurance, that you get a fair deal, that you're being treated well by your insurers. So we prohibited insurance companies from imposing lifetime limits, which oftentimes if a family member really got sick, they thought they were covered until suddenly they hit that limit, and now they're out hundreds of thousands of dollars with no way of paying. We said to insurance companies, you've got to use at least 80% of your premium that you're receiving on actual health care, not on administrative costs and CEO bonuses. And if you don't, you've got to rebate anything that you spent back to the consumer. So there are millions of Americans who've received rebates. They may not know that they got it because of the Affordable Care Act or quote-unquote Obamacare, but they're pretty happy to get those rebates back because it made sure that the insurance companies were treating folks fairly. We said that any young person who doesn't have health insurance can stay on their parents' health insurance until they're 26 years old. And as a consequence, what we've seen is steadily the rate of uninsured for young people dropping over the last 3 years since the bill passed. And obviously providing a lot of relief to a lot of parents out there, because a lot of young people, as they've been entering into the job market at a time when jobs are tough to get and oftentimes benefits are slim, this is providing an enormous security until they get more firmly established in the labor market. We provided additional discounts for prescription drugs for seniors under the Medicare program. But a critical part was, how do we provide health insurance for individuals who don't get health insurance through the job? It's a historical accident that in this country, healthcare is attached to employers. And part of the problem is, if you're out there shopping for health insurance on your own, you're not part of a big pool. Well, there's no aggregation of risk taking place for the insurers. So they're basically going to say, let's see, you're 50 years old, you got high blood pressure, and we just look at the actuarial tables and we figure you're going to get sick, so we're going to charge you $1,500 a month for health insurance, which the average person has no way of affording, because there's no pooling of risk. So what we said was, we need to set up a mechanism to pool people who currently don't have health insurance, so that they have the same purchasing power, the same leverage that a big company does when they're negotiating with the insurance company. And essentially what we've done is we've created what we're calling marketplaces in every state around across the country, where consumers are now able to be part of a big pool. Insurers have to bid, essentially compete for the business of that pool. And what we now have set up are these marketplaces that provide high-quality health care at affordable prices, giving people choices so that they can get the health insurance that they need and they want, and the premiums are significantly lower than what they were able to previously get. I'll take the example of New York State. If you're, say, a 27-year-old young woman, don't have health insurance, you get on that exchange, you're going to be able to purchase high-quality health insurance for less than the cost of your cell phone bill. And because all the insurers who participate are required to, for example, provide free preventive care, free contraceptive care, that young woman, she may make up what she's spending in premiums just on her monthly use of health care. So this is going to be a good deal for those who don't have health insurance. Those who already have health insurance get better health insurance. And the best part of the whole thing is because of these changes we initiated in terms of how we're paying providers, healthcare costs have grown, as you pointed out, Mr. President, at the slowest rate in 50 years. We are bending the cost curve and getting at the problems that are creating our deficits in Medicare and Medicaid. I think President Clinton makes a really important point. And the way pools work, any pool, is essentially those of us who are healthy, subsidize somebody who's sick at any given time. We do that because we anticipate, well, at some point we'll get sick. And we hope the healthy person is in our pool, and so those costs and those risks get spread. That's what insurance is all about. And what happens is if you don't have pools that are a cross-section of society, then people who are already sick or more likely to get sick, they'll all rush out and buy insurance. People who are healthy, they say, you know what, I won't bother. And you get what's called adverse selection. Essentially what happens is that the premiums start going higher and higher because the risks aren't spread broadly enough across the population. So you want to get a good cross-section in every pool. That's why big companies have an easier time getting good rates for their employees than small companies. Those who have opposed the idea of universal health care in the first place and have fought this thing tooth and nail through Congress and through the courts and so forth have been trying to scare and discourage people from getting a good deal. And some of you may have seen some of the commercials out there that are a little wacky. And the main message we have, and we're using social media, we're talking to churches, we're talking to various civic groups, and what we're saying to people is, look, just go to the website yourself. Go to healthcare.gov, take a look at whether this is a good deal or not. Make your own decision about whether this is good for you. Because what we are confident about is that when people look and see that they can get high quality, affordable health care for less than their cell phone bill. One of the things you and I both know is that when you come to health care, there's no more personal and intimate decision for people. I mean, this is something that people really care about. And frankly, the devil you know is always better than the devil you don't know. And that's what Harry and Louise was all about back in the 90s, right? It was scaring people with the prospect of change. And so part of our goal here is just to make sure people have good information. And there's been billions of dollars spent making people scared and worried about this stuff. And rather than try to disabuse people of every single bit of misinformation that's been out there, what we're saying is just look for yourself. Take a look at it, and you will discover that this is a good deal for you. Just make sure that you show us that you've got health insurance for your employees. If you have more than 50 employees and you're not providing health insurance for them, you now have the opportunity to join a pool of small businesses to get a better price and a better deal on health insurance. You're eligible for tax credits in providing health insurance to your employees, up to 35% of the premiums for each employee will be a tax benefit, a tax credit from the federal government. But if you still aren't providing health insurance for your employees after that, then we're going to go ahead and penalize you for it. And I can understand why some businesses wouldn't want to pay for it. If they're not currently providing health insurance for their employees, what that means is that they'd rather have those additional profits than make sure that their employees are getting a fair deal. In some cases, they may be operating under some very small margins. But keep in mind, since companies are exempted, the average small business with 5 employees, mom and pop shop, 10 employees, they're not under that requirement. So I'm not that sympathetic to a company typically. If it's got more than 50 employees and generating some significant revenue, we're making it affordable for them to provide health insurance for their employees. They should do the right thing.
We have to close, but I think there's one last issue we ought to deal with. The most important thing, obviously, is just to get people enrolled in this. We'll work through it as we go along, but you just heard the President say that so far in virtually every state, the actual prices of the insurance are coming in quite low, a bit lower than they were originally estimated to. With the original price estimates, and with the government obligated to provide subsidies, which cost money on the budget, right? It was nonetheless estimated that in the first 10 years, this would keep the national debt $110 billion lower than it otherwise would have been.
The total cost of the Affordable Care Act to provide health insurance for every American out there at an affordable rate is costing about the same amount over the course of 10 years as the costs of the prescription drug bill that President Bush passed. Except that wasn't paid for. We felt obliged to actually pay for it and not just add to the deficit. So what we did, it's paid for by a combination of things. We did raise taxes on some things. We, for example, said that for high-income individuals, you can pay a slightly higher Medicare rate. Do we want to continue to live in a society where we've got the most inefficient healthcare system on earth, leaving millions of people exposed to the possibilities that they could lose everything because they get sick, where we've got little children and families going to the emergency room once a week because they got asthma and other preventable diseases because their families aren't linked up with a primary care physician who's providing them regular care, where the costs to society for reduced productivity, illnesses, etc., all burden our businesses. Is that the kind of society we aspire to? I think the answer is no. And the notion that we would resist, or at least some would resist as fiercely as they would, or as they have, make this their #1 agenda, is perpetuating a system in which millions of people across the country, hard-working Americans, don't have access to health care, I think is wrong.
We have to close, but I'll close with a story. You know, I told you all this morning that the employee that our health access program lost in the Kenyon Mall shooting was a Dutch nurse. And we spent a lot of time in the Netherlands. We got a lot of support there. Oxy is one of the biggest insurance companies in Europe. They're one of our partners here. I went to celebrate their 200th anniversary with them. They started as a fire insurance company with 39 farmers 200 years ago. And we were out there in this big farm field in a tent in the shadow of a 13th century church and a big Dutch windmill. And I asked the chairman of the company, I said, you write health insurance? Because in the Netherlands, there's no Medicare, no Medicaid. Everybody's on an individual mandate, and you just subsidize people based on their incomes. He said, yeah, I write it, we all do. And he looked at me and he said, but we don't make any money on it. And he said, we shouldn't. This guy's on a huge insurance. Can you imagine somebody saying that in America? He said, we shouldn't. If I can't make money on this business doing traditional insurance business, I got no business to work. He said, look, healthcare is a public good, and you've got to find a way to finance it for everybody. And it's an intermediary function that somebody has to handle. But in the end, it's how it's delivered, how it's priced, and how healthy you can keep your people. So the First Lady's trying to keep us all healthier, and you're trying to change the delivery and the pricing, and you have to cover everybody to do it. I think this is a big step forward for America. This will, over the next decade, not only make us healthier, but it will free up in the private sector largely funds that can then be reinvested in other areas of economic growth and give us a much more well-balanced economy. But first, we got to get everybody to sign up.
Everybody sign up. Go to healthcare.gov. Thank you very much.